Idealism prevails. Make the world a better place.
It's getting close to half. So already the government's doing a tremendous amount of the spending that you're seeing. As for, and by the way, where's the Trump plan? The answer is we don't have it yet, which is a huge problem, which is also why I'm sort of talking around this. They were supposed to do something, they did not do it. The skinny repeal did not happen, we know about that. But Medicare for All is a magic chocolate cake that you can eat endless amounts of, never runs out, and will not make you gain a pound. It simply doesn't work.
That sounds delicious.
It's also not real. So the problem with Medicare for All is first in the name. It's not Medicare for All, at least if we're talking about the Sanders plan. Elizabeth Warren is still figuring out, I think, what her plan really is, or at least how it will be paid for. Medicare for All is a misnomer. Medicare has cost sharing, states kick in money, individuals kick in money.
Not Bernie's plan.
I'm sorry?
Bernie's plan does not have cost sharing.
I understand that. I'm saying Medicare has cost sharing. So Bernie's plan does not, which means it'll be much more expensive on a per capita basis than what you have with Medicare. And oh, by the way, you also, if you look at the usage rate that you would have, people would just show up and say, I want to take this procedure, I want to do this. They would have no skin in the game. So the cost estimate, I know we can talk about this for hours, we only have like 20 minutes. The cost estimates are on the low end at $30 trillion. We just can't do it, we can't afford it.
Sally, I want to go to you and then Jonathan. I was interviewing Ezekiel Manuel. He helped write Obamacare, the Affordable Care Act, whatever you want to call it. And he said he had structural concerns with Medicare for All, but he also said the Democrats would have to take over the world for it to pass. There are only 118 co-sponsors in the House. There are 14 in the Senate. How could this even pass Congress?
So, if I can step back a second, what I do find maddening about the way we have these conversations, and then all of us, right, is that we go to, think about the progression of the conversation, right, structurally. We went first to, okay, Medicare for All, how do we pay for it? And then we went, okay, Medicare for All, but how will you pass it? And we didn't yet have a conversation, which, in a way, the mayor alluded to too, which is actually, what do we want as a society, right? And let's be clear, I'm not a socialist, so there are certain things I believe belong, and nor am I a communist, there are certain things I believe function better in the private market. And there are certain things where I worry about only having a private market, for instance, education, right? I think most of us, hopefully, a lot of us, I don't know, Buck, but can agree, right, that, you don't want to have a situation where, or that's why I worry about private prisons, right? I do not think there should be an economic incentive for industry that cuts against justice, right? And so I think that's something that you shouldn't have industry that makes money off of, right? And I tend to feel the same way about our health care. Now, let me be clear about something. I currently get my family's health insurance through Obamacare. It is much better and more affordable. It's more comprehensive and more affordable than what we were able to have before. And I still pay, I live in New York, I pay $1,800 and some change per month for 3 people to be covered with a $13,000 a year deductible. So, how we, and this is where, the how do we pay for it part is, this is where Warren and Bernie get it right. People aren't stupid, they know money's money. And so, yeah, if I'm not paying it in taxes, right, I'm paying it, right? My family's had 2 ER visits in the last 2 months. Don't ask, everybody's fine. Watch out for floor molding, that's all I can say. So, but this is actually real, and these are pocketbook issues, and in a way to put the kind of how do we do it cart before the horse is to almost either to take off the conversation that we should be having about how we think certain parts of our society would work best. And I, for one, think that the insurance companies have spent too long profiting off our sickness. We pay more as a country for insurance and for medical care for worse and worse outcomes. Right? We see that the incentive structures are all wrong, and meanwhile we actually see good outcomes under systems like Medicare. That's where I start this conversation.
If I could interject.
Let me first go to Jonathan, because I want to talk.
When you talk about insurance companies, that is part of the problem. We could all agree. I think the insurance companies have turned this into a corporatist system. So I would agree with you on that. And my apologies for interjecting.
Jonathan, you spent 5 years writing a book about healthcare. What did you find out?
So thank you, and I'm also in kind of the least sexy position here, which is I'm a centrist, right? And I've seen all sides of this, and the reason I've seen all sides of this is because, as you say, I spent 5 years writing a book called Dying of Whiteness, where I went around Tennessee and Kentucky doing focus groups with white and African American and Latino men and women, talking to them about health and healthcare reform, and I saw some things that I think were pretty important. Number one was in my comparison of people in Tennessee. Tennessee did not expand Medicaid. It did not create a competitive insurance marketplace versus Kentucky, which for a period of time did. I saw that people in Tennessee had worse health outcomes. They were paying more for their medications. There were more medical bankruptcies. And really what I saw on a kind of granular level, kind of on a small granular level, was at least the effectiveness of the Affordable Care Act for lowering medical costs, and it was particularly so when Kentucky had health insurers, a kind of a health insurance exchange where people were competing with each other to lower costs. And so it did make me think, even though I'm a quite liberal person, it did make me think that this combination of a government program with a private program where there was actual competition, at least in the data that I showed, it led to dramatically more healthcare coverage, particularly for African American and Latino populations. African American uninsurance rate, for example, in Kentucky, when they did adopt and expand, went from about 40% to 5%. So I think I just want to mirror a couple things based on my experience. Number one is, I completely agree. In other words, I'm so sad, I'm a doctor, right? I'm so sad that this is such a partisan issue. I understand why it is. But ultimately, I think we want to get to a system that helps the most people. Ultimately, we want to get to a system that doesn't bankrupt people, that people don't have to make the kind of trade-offs that my research showed people had to do in Tennessee just to stay alive in a particular way. So on one hand, I did wonder in my research, why was it that Democrats were running away from a program that had started to work? It was kind of like, Atari Pong or your first iPhone. It was a technology that maybe could have been improved. Thank you for laughing at that. So I think part of the issue is, I think that there are real benefits to the Affordable Care Act, and that's part of the issue. The other issue I found, and for people who've read my book know this, is that there are real resistances, and just read my book to see what those are, but there are real resistances to 100% government program. And I think it's important for those to keep in mind that Medicare for All is not just a policy position, it's actually something you've got to win an election for. And the question is, are you going to be able to win votes when you're, can you win a national election based on a program that's entirely government funded? And I think that's really the question I would have.
Briahna?
I'm asked that question a lot. Is this the smart electoral choice? And it always boggles my mind, because Medicare for All is overwhelmingly popular, not just with Democrats, but a majority of Republicans support it. So the question isn't whether or not it's safe to run on Medicare for All, it's how are you going to win an election telling people that the system they know is already failing them, the system that has the average American family paying $20,000 a year in premiums, and that's before they actually incur an emergency. People who have to pay hundreds and thousands of dollars out of pocket because their deductibles are high, not to mention people who are rationing their insulin and dying because their GoFundMe didn't come through. When insulin cost 1/10 of the price, 50 miles before where my senator lives in Vermont, right? So this is not just a political question, it's not a financial question, it is an ethical question. And the question is, in the wealthiest country in the history of the world, do we want to have 500,000 people going bankrupt from medical debt every year? Do we want to have 30 to 40,000 people dying from a lack of health insurance? Given especially the fact that we absolutely can pay for it, because to your point earlier, Buck, the government is already paying a significant portion of healthcare costs. And under the current system, the government is paying more than it should into an inefficient system because the private healthcare industry is drawing profit out of that system, and there are enormous administrative inefficiencies. And so what we're going to do is say the profit motive should not be in this at all, that nobody should profit off of sickness and death, the way that nobody should profit off of your house catching on fire. We don't want a private fire department, we don't want a private police department, because this is something that we believe is a human right and that nobody should be making money off of.
So I think that the moral case that's being made for we should cover everybody, it's compelling, and there's a lot of things, slogans, stories, anecdotes you can tell.
Those are lives, not slogans.
Well, I mean, Medicare for All is a slogan, it's not even really Medicare, but I mean, the point is,
30,000 people dying is not a slogan.
Okay, I mean, right. So a few things about this. One is you have 90% of the country already has health insurance. Of the 90% of people who have health insurance, a vast majority of them actually like their health insurance. You will recall that the big problem the Obama administration, to try to deal with the political question for a second, other than just like everything will be free, school, college, healthcare, it's going to be amazing. If you remember, the Obama administration had to promise people you won't lose your plan. And that was a lie. PolitiFact, everybody else said, yeah, that was a lie. Why do they have to tell that lie? Because there were a lot of people who liked their plans, who lost their plans because the government came in and said, we've got a better way for you. It is the reason you're hearing Joe Biden and a few other candidates, but Joe Biden, who is still the Democrat frontrunner, say that they're not going to do this. He's not in on Medicare for all. He's actually talking about Joe Biden now, creating competition in having a public option and having competition around the public option, which is akin to what they do in Singapore and Switzerland, where you do have universal coverage, but the market is actually setting prices and not just government mandate deciding what you should have here and there. And that brings costs down. The whole focus of Medicare for all is wrong because instead of just looking at who's insured, how do you make care better and how do you insure people so that they can get care more easily? What's going to happen? I mean, if you look at Medicare and Medicaid as it is right now, doctors don't want to take it. The insurance that we have, sorry, Sally, not you, but it's just the insurance that other people here have, is subsidizing Medicare and Medicaid at hospitals because they pay rates that are below what it actually costs to deliver the service. So you're already saying.
Can I ask a question? Sorry, this is just a really important question. So, Buck Sexton, are you saying you would support the public option? You just sounded like you were downright.
The public option is a serious proposal that could be workable. Under certain
all right, ladies and gentlemen, panel over. I see it all. I mean, this is partly why we should be having this conversation, because we are changing the conversation by even talking about where the private
I think his point was countries, they have more free market systems.
Let me explain.
Just really quickly, I mean, the public option is workable in the context of Medicare for all is preposterous and absolutely cannot work, will make your health care worse. You will have rationing, you will have shortages, you'll have taxing.
None of that is true.
Class.
It's just factually, demonstrably untrue. And so that's the thing. I don't have to.
I mean, can we back up and look at the history of healthcare coverage in this country? You know, it started, we basically had catastrophic insurance, but people were responsible for out-of-pocket costs, right? Before FDR implemented wage controls during World War II. So that was, even though there wasn't a public option, that was much like what the systems in Singapore and the Swiss have. You have catastrophic insurance with high deductibles for catastrophic injuries and accidents. You pay for out-of-care for other things, but there was competition between insurance companies and competition between providers, and also the consumer had skin in the game, right? How much does anyone pay for a broken arm? Does anybody know? And seriously, I mean, how much do you pay for?
The hospital won't even tell you.
How much do you pay for your oil change? It's posted, isn't it? It's posted. We have no idea how much you pay for anything because the system is so screwed up, there is no price mechanism anymore. That's why we have seen skyrocketing costs, because there's no competition. Nobody shops around because the insurance companies pay for it. I absolutely agree with you. I'm sorry for my rudeness in interjecting. Part of the problem
you can always interrupt to agree.
And I also like chocolate. I also like chocolate cake. I'm with you on that.
It's a bad
But the insurance companies essentially are backed by the government with all the regulations and everything that we have. It's not a private market. So that's the issue, is looking at free market reforms. And what we say is well, this system isn't working because it's a free market system. It ain't a free market system. And if we were to come to that conclusion, we would realize that if we were to step in that direction, we would be doing much better than step in the other direction of a more totalitarian, authoritarian, socialized system.
Let me get Jonathan away.
Well, I mean, the data that I have basically shows that if it was entirely a free market system, the people who get screwed by that are the people at the lowest end of the socioeconomic spectrum. And so
that's why you have private charities and other organizations that help in that respect.
That's
the thing. People hate each other, so they're not going to help each other out, which please go ahead.
Private charity can never. The whole point of a single payer system is that without everybody buying it, without this efficiency of scale, the costs go up because.
What if I don't want to participate?
If there's what if you don't want to buy insurance for your car?
Then
you're not allowed to drive.
Exactly.
That's how it works.
But you're saying it's a system where everybody has to participate, and if they don't, what are you going to do to them?
Right, just like the public school system and our public library system.
But we have,
and our
now
fire
in
department.
our public school system, you have private alternatives. You don't necessarily have to
Right,
participate
so
in
under
the home
Medicare for
school.
All, there
But
will
the
still
question
be
is,
a
again,
need.
what will you do if people don't want to participate in the
So let
system?
me tell you, under Medicare for All, just like in a lot of the socialized.
You will throw them in
medicine-
jail, is what you will do if they don't want to pay their tax to participate in the system. That's what you're
I don't
going to
think
do.
anybody on
That's
this
not
stage
freedom.
or in this room actually believes that's the case. What actually, the reality of the situation is, just like in Canada and a lot of these other countries, there is private insurance, boutique insurance that you can buy if you so desire. The very, very wealthy in a lot of these countries still have the option to buy their specialized for their plastic surgery and any other kind of non-medically indicated thing that they want to do. They can
And
go
the
far
cost of the cost of those procedures is actually going down here in the States
But the
because they're not
reality
provided by the
is,
government.
very few people actually take advantage of that because people like their health care. Bernie Sanders did this on a Fox News debate and challenged the host who thought that they had the crowd with them because it was a Fox News panel. And he said, who in this room would be willing to leave their health insurance to move to a Medicare for All system where they pay no deductibles, no premiums, no copays? And almost everybody in the room raised their hands.
There's
so
a
this
reason for
lie,
that. There's a
I'm
reason
sorry.
for that.
There-
You can look
this-
at polls. I'm sorry.
No,
I know.
it is not true that people like their health insurance. It's just not. People are afraid of losing their health insurance. And you know how people lose their health insurance under an employer-based system? Becoming unemployed. The average person has 12 different jobs by the time they're 60 years old. That's healthcare instability. The average person, if I'm a member of the Black community and our insurance rates are typically twice as high as others, why should I be invested in an employer-based model? And to your historical point, the only reason we have an employer-based model is because during World War II, there was a shortage of men to work in these jobs. And so people started raising salaries to try to attract talent, and they were afraid that inflation would occur. Therefore, they put a cap on salary. People default us to start.
There are 2 points though.
They put a cap on salaries, and they decided to. So companies started to try to seduce people to come work for them by offering insurance.
Which is how we ended up
So
with
by-
the
Let me go,
Let's
Jonathan.
just say, where does the cost,
Equal time.
where does the
Jonathan,
cost go?
Jonathan.
I think it's important to know where does the cost go in our system. In other words, I think, in the data that I've analyzed, we all definitely fail as a society because all of our cost goes because people who don't have insurance end up going to the emergency room, and emergency rooms have mandates that they have to treat everybody. So people, you wait if you don't have insurance, you wait until you have, 6 months of diabetes or cardiovasculars. When by the time you get to the emergency room, you're in failure in many ways, and so the cost goes down, right? And in the data that I looked at, for example, Tennessee had an aggregate 3 to 4 week shorter lifespan because all of the costs in the system were going toward lower income and uninsured people coming into the emergency room. So I think that this free market idea that doesn't account for the fact that cost is still going to be the most expensive cost if it's not more equitable. The other issue is I can see that this idea. Why did we get Medicare in the first place? It's because we aggregated shared risk. That's the whole idea of health insurance in the first place, is to aggregate shared risk, particularly among people who are the highest risk, like people who are elderly, for example. That's where Medicare came from. And so all these programs that fraction things out, I still think are going to end up with more aggregate costs than something that is aggregating risk.
A few things. One, the focus on the ER is interesting. Most healthcare spending occurs when and where? It's elderly people, and most of it occurs in elderly people in the last 6 months of their lives, which is why Medicare, not ER visits, is the single biggest problem we have in the national debt, in the deficit year in, year out. No question, we're at $23 trillion. If we hit, I know I sound like Ebenezer Scrooge over here, but math is math. If you look at what would happen if you had normalized interest rates, we'd already be in a world of trouble right now. And I know that's just the financial end of it, but when you're looking at where all the spending is really happening, you mentioned hospitals. Hospitals are being effectively given monopolies these days by the government because the way they have to take Medicaid patients, they have to take Medicare patients, and then they're passing those costs on to other people as a function of just the way that they do business, which is why when you bring up costs, by the way, I have friends who've had this experience. If you walk into an ER and you say, how much will this be? They can't even tell you. They won't tell you. They will refuse
They can't tell
to
you.
tell you.
They can't tell you. They don't know.
Well, that's what I mean.
Yeah.
They refuse to tell you. They will not tell you. They do not. They don't know, by the way, either. They'll
That's
make
my
up.
point. They don't know.
They don't know. They won't tell you. So you have a system where people are saying the market and price don't work. That is explicitly designed to make sure that market mechanisms and price, which is the single most important signal don't exist really, and then you have people telling you you're going to have better health care, it's all going to be amazing.
But that's not because of the government, that's because of private industry.
Yeah, I mean, your claim is that.
Well, again, you have to delve deeper into this, and everybody's just like, this is how it is now. Again, when you talk about a third-payer system that relies so much on the health insurance companies, that actually is a result of salary and price and wage controls from FDR.
And the single most important thing about how much people like Medicare for all, I mean, that's like saying, would you like me to just deposit $10,000 a month in your bank account?
Right.
And yeah, of course, that's
If
and that's
that's
and you move forward,
Yang
I have to
winning
finish
and
the
he's not.
sentence or else it makes no sense. $10,000 monthly bank account, but next month I'm going to take out $20,000. You wouldn't like that, right?
But
This
isn't
is the
Medicare for all
this is the
all for more
problem
transparency?
with not being honest about the cost.
Sally, I want to ask you a question, and we'll open up for the panel. I used to cover healthcare, and there's a lot of talk of Medicare for all being socialism, but Medicare is actually a public-private partnership. And the whole issue of private insurance companies having no role in being abolished is actually a myth. That's a myth, the Medicare for all, because Medicare relies heavily on insurance companies. So is Medicare socialism?
So, first of all, let's back up. Part of the issue, and in all fairness, Mayor, too, is like, you know, we've and like, I find this whole conversation maddening, but I find everything these days maddening. So forgive me. You know, this was the sort of point that someone said, like, oh, well, if Warren or Bernie is the candidate, they're going to be attacked by Republicans as socialists. I'm like, listen, I'm old enough to remember when Republicans attacked Obamacare as socialism. Like, we're now just using these sort of shorthand words to characterize things, right? And I don't find that actually helpful. And honestly, I find it a little disingenuous.
It's corporatism because it's,
right, but
which is
fine, but like,
different. But it's, you know, it's still heavy government involved.
Right. So let me finish my thought. So
Yes, ma'am.
here's the thing. So I actually think that what is more constructive, right, if we could get to a place as a country, I know, call me a dreamer, is where we would actually talk about what do we think. First of all, whose care do we care the most about? And I actually think that that's a piece we don't talk enough about, right? Because we do have a system right now that prioritizes certain people's care. It prioritizes the care of mostly well-to-do middle-class and upper-class employees, people with jobs who have good Cadillac insurance, and the elderly. That's true. And why do we do that as a society? So if we actually were to say we morally and ethically care about the care of all people, which I actually don't know we do, then what would actually be a system that would get us the best care? Now, I happen to, again, like taking big chunks of this. You're right, it's ultimately a private-public partnership. Let's not even use the language in terms of shorthands. Taking big parts of the profit motive out of the insurance company. If you want to add to, fine. Just like, you know, you want to send your kid to private school, fine. But where we make sure that the baseline for everyone is better, the care is better, while, I'm sorry, but all the numbers and all the math show the overall cost, the money we gotta spend coming out of damn pockets goes down. Like, I don't understand. I'm not the smartest person in the world, but it seems to me if I can get something better, right? It's like, I like going to Costco, right? I live in New York, so I don't have enough room to store all that stuff, but when I have a chance, I like going to Costco, so I can buy like a whole bunch of paper towel rolls at once, and then they just are in my living room, because I don't have anywhere to put them. But the whole idea of Costco, right, is like we all are getting the big bulk, right? It's like, I like the idea of spending less to get better care, and I like the idea that it's not just the very rich and the very well-employed who we give a damn about in this country, but that we actually think that people who do not look like me and do not earn like me should get the same quality of care and have the same quality of basic existence.
And that's true. Here's the question, and we have framed it as, you know, either the government is extremely good at somehow creating resources and wealth, which it does not do, and allocating those, or not. That's where we're coming from. So here's the thing, is what system is actually better at allocating scarce resources, because they are scarce. We do not have unlimited resources. As Buck said, this country has $23 trillion in debt. The reason that that's a big deal, among other things, is because interest rates have been artificially subdued at this point. They're paying about 2.15% a year, but we still pay over $400 billion payment on the national debt. If the interest rates go up, we're going to be paying $1 trillion a year in national debt, which can bankrupt this country in short order, right? So we're saying that organization is better at allocating resources than the private market, in which you have competition. And the profit motive is important because that drives costs down and quality up, because people can choose what they want.
America is in debt because of $1 trillion tax cut, because of an enormous amount of military spending. Every Republican administration of the last 30 years or so has been the one that puts America in debt and everything.
Now, America has been in debt for a lot longer than that.
This is the reality situation now. You have framed this as a who's best at creating profit, government or private industry.
I've created it as who's best at allocating scarce resources. That's a different. Government does not create profits. Government does not create resources.
Good. I'm glad you clarified that, because I was concerned that we're still thinking in this profit model. And when it comes to allocating resources, the answer is absolutely the government. That's the whole. Medicare is one of the most popular programs.
It's cool. I'm gonna go out and get my $10,000 cell phone instead of my $800 coolest phone ever, because that's what it is. The government ran the cell phone industry.
Is one of the most popular programs in America, because Americans know what it feels like to be in need. And my concern about what you said earlier, your argument seemed to be, and correct me if I'm wrong, is that because there's no transparency with prices, people are going to the hospital not knowing how much it costs and then incurring costs because they're like, oh gosh, I didn't know that was a bad deal. People go to the hospital because they're in an emergency, and because there should be no market. Willingness to pay, ability to pay shouldn't come into play when you're facing an illness that could kill you. That's why we don't believe there should be profit.
So let's be clear. You don't want somebody who took out $500,000 of loans and was top of their class at medical school, who's trying to make money and is actually reflecting. This is the reality of. This is the reality of.
Because the government has put $3 billion into
it's all going to be free.
It's actually much cheaper to cancel student debt than to have the recent
right. Also cancel my credit card debt, please, while you're at it. The reality, it's just as moral. There's no reason not to. I was paying for food and gas. I should. What am I supposed to starve to death? I mean, cancel that too. I would just say that when you're talking about, like, you're asking about price and how price matters. He's talking about allocation of scarce resources. Do you really think the government is going to be better at making sure that more people get health care than people who are incentivized to actually do this for you?
In the private insurance industry, yes.
The private insurance.
I think it's really cool too. We could also have people driving around their Model Ts if the government ran the auto industry.
Insurers loved Obamacare because it created mandatory customers for them. So the insurance companies did not. I know it's a whole dose of reality.
That's why we want to get started.
They love Obamacare.
Let me go, Jonathan.
Thank you. We already have that data to answer that question, and the answer is the Affordable Care Act. I mean, just look at what happened in Kentucky, for example, where uninsurance rates, for example, for African American populations in Kentucky went from 45% to 5%. Latino populations about 50% to 10%. So actually, the Affordable Care Act did show that we could insure low-income white and all low-income working class people got better health insurance.
Why not just expand?
Doctor, what insurance companies are allowed to compete under the Affordable Care Act?
No, I'm very.
No, that's the question. Is there competition between
right.
bunches of different insurance companies, or is it relegated to a very few who actually wrote the legislation?
But that's why I find this debate so frustrating, as I mentioned before, because the Affordable Care Act was like a starter program, right, in a particular way, and states that did adopt it the most robustly had the best experience with just honestly longevity and access to health care. And so
again, though, is there free competition or no? It's very restricted. I mean,
but I mean, it's ironic.
No, that's the question.
Yeah, I'm about to answer it. That it's ironic that the states that have the least competition are GOP states.
I'm not talking. That's
that
great
don't have
because
insurance marketplaces.
Again, how do we frame the question? Is it essentially open competition, or is it very restricted competition? You understand what I'm saying?
I totally understand what you're saying.
If you had open competition, what would that look like?
The states that have the least competition among competing insurers are the ones that are GOP states that basically blocked the program. So the states where this works the best, where there's the most robust competition, and where the best public-private partnerships are states that have the most competition.
Okay, so if we were to open up competition much more so, we would have even better results.
Again, I'm saying that it's a public-private partnership.
But no, if we were to open up competition even more so, we'd have better results.
All right, we're going to open it up for questions in a few minutes. I do want to ask one key question, and critics of Medicare for All, be honest, go to you, have noted that Medicare for All did not work in Vermont. Why would it work in America if it didn't work in Vermont?
This is exactly the issue we're talking about here. If you don't have, first of all, what was tried in Vermont wasn't a full single-payer system, and we didn't have Democrats, I believe there was a Republican governor at the time. There were a lot of structural issues, people who were fighting the bill in Vermont. Vermont is painted as this liberal bastion because Bernie's there, but Bernie has done a lot to actually make it a progressive bastion and turn what is a very kind of like live free or die state into one that supports these issues because it shouldn't be partisan. Bernie is amazing at communicating the fact that these are human rights issues and not about partisanship. But the reason that it's more difficult to have a state-based program is because you don't have the same pool to pull from, right? So what you need is to not have people be able to pick and choose like the private insurers do, kick pregnant women, people with pre-existing conditions, et cetera, off of the rolls and ensure healthy people only. And when you have a countrywide single-payer position, you're more able to do that. And when we're talking about private health insurance, I just want to say, Medicare Advantage, these private aspects of our public programs actually drive costs up. If you look at the amount of waste that is in our Medicare system, the most wasteful aspect of an otherwise fairly efficient system, much more efficient than the private insurance industry, is where Medicare Advantage comes in. Because people will buy into those programs with their private money, and they ended up charging more and taking more basically of the government's are paying a share of the private insurance of the Medicare Advantage plan.
Those are private plans.
Yeah, that's the point. So Medicare Advantage ends up disadvantaging the government and making it put more on its payroll. So that is exactly why all of the people, other candidates who are fighting for, you have to ask yourself why, a reason to maintain a role for the private for-profit industry in our healthcare. It's not because they're looking out for the interest vested to the average American.
I absolutely agree. A lot of it has to do with the insurance companies and the fact that they have an incestuous relationship with government, so you've made our point.
Yeah, the government regulation actually makes things more expensive and worse, which if you look at pretty much any program in the history of the United States government would always be the case. But they want you to believe now that they're going to be really efficient, lean and mean, and they'll be great at paying.
It is efficient. You can read on the internet how efficient Medicare for All is compared to private
Okay, well, it's fascinating.
It's just fact.
When they compare it, for example...
Wait, were you just about to ask if we should expand Medicaid? I thought that's where you were about to go.
That's what I thought you were going also.
I was talking to something else. What do you?
No, I know, but like 10 arguments ago. We're going to
why,
argue for expanding Medicaid?
Why not just do a...
Do you support that?
No, the point that I was trying to make... I asked the question to see if you'd say yes. Look, the point is that what happened in Obamacare is there are some winners and there are some losers. And that's why they wanted people in individual markets who are younger and healthier, subsidizing people who are sicker and older. The reason they won't just expand Medicaid, if the problem is really covering everybody, you could just expand Medicaid so that it covered every person in the country who didn't have health insurance.
But who's blocking that?
We're expanding Medicare to cover every person who doesn't have health
Who's
insurance.
blocking Medicaid
Who's
expansion?
blocking expanding Medicaid? Who's been doing that? Wait, someone remind me, which party? Wait, hang on, which?
No, but why isn't that the plan? Why is it kicking 160 million people off their health insurance and deciding to remake the
But you're effectively arguing for Medicaid expansion?
I'm not arguing for Medicaid expansion. What I'm arguing for is you want to drag people from the private market into one giant market so that they can subsidize other people in the market because Medicaid is bad health insurance. Why is it bad? Because there's only so much political will to pay money into it. Why is there so much political will?
Because
there are
we
standards-
hate Medicare.
No, because we systematically fuck over poor people in our country, and then what? I'm sorry, what?
I mean, you're giving poor people, but the same people that are screwing over poor people, who are actually Democrats too, they're going to fix the system by giving you more power.
Free shitty insurance. And so what do? They go to the hospitals to get primary care. They drive up costs for all of us. And you know what? Even in our infinite wisdom, we still hate poor people so much that we can't imagine actually fixing the system in a structural way so that they're not relying on ERs for medical care. We said, no, that would be giving them free shit. Like, come on. And let me just say, look, like I said, I support Medicare for all candidates, but I don't have a particular horse in this race. I believe in what actually works. And as I said, I worry about the idea of structuring an entire healthcare system on the idea that, it's sort of the hinge point of the whole thing is the profit motives of the insurance companies, which, by the way, that's the one thing we're not talking about here. Excuse me, Buck, I let you talk. The American people may be sick, but damn, those insurance health company profits are healthy. So I don't like that. But here's the thing I'm a little confused. Mayor, Buck, all I ever hear to your original question from the other side of this debate is bad, and let's get rid of Obamacare. Well, so we're debating right? And I'll include you in this. We're debating how to, hey, we've got a system, it doesn't work perfect. There's some parts we like, there's some parts we don't like. We all agree that we're paying too much for overall shitty outcomes. Well, I'm just gonna curse like crazy now. I've just already started. But we're debating how do we fix it and expand care for more people, and how do we think about those trade-offs, whereas all I keep hearing is attacks on those solutions and no other idea, which is like,
I think
that's charity care, which I'm sorry, but there are enough
because we've been talking, we're trying to frame it correctly, which hasn't been done. We can look at things like healthcare savings accounts. We can look at things allowing competition between insurance companies by buying between state lines. We can look at better tax incentives. We can encourage people to take better care of themselves, which is not going to happen under this system either, because if people are just paying the bills, why should you take care of yourself? We can look at better alternatives with preventative medicine. It's just a number of things that we can do. But we don't do that because we just get caught up in Medicare for all instead of actually looking at what we could do that are market reforms.
I invite everybody to read.
Let me go to Jonathan. Let me also say, if you have a question, line up right there.
Oh, there are audience questions. Awesome. I invite everybody to read the Affordable Care Act. There's like 70 cents on the dollar for part of the Affordable Care Act is for community and preventative health. It actually was trying to get states healthier, in states like Tennessee that have dramatic rises in smoking, obesity, cardiovascular disease. So part of the issue is there was a huge program built into the Affordable Care Act for community and preventative health, and that gets lost in the debate. The other thing is, I do think it's fair to say that part of the reason we're having this debate, certainly we all want to fix this, and this problem is untenable, but it's also the absence of a Trump plan. In other words, if your debate is, if your position is just, I'm going to undermine the Affordable Care Act at every step, but not present a viable alternative, then it leaves people with this kind of issue of, well, what's the alternative? Right now, there really is no alternative.
Let me get to questions. We've got a fair amount. I don't think we're going to get to them all, but go ahead.
Hey, thank you for your time. I work in the mental health field, and I noticed that many clinics like mine struggle to take Medicare and Medicaid due to the low reimbursement rates, excessive paperwork, and long wait periods for reimbursements. Due to this, many clinics refuse to take the program at all. It would be easier to take private insurance that reimburses 3 times the rate and have vastly less governmental paperwork. How do you respond to concerns by providers like me who want to see people, but ultimately the reimbursement rates aren't even manageable in our clinics?
I'm happy to take that.
Sure.
So thank you for the question. I also want to reframe it and just also say from the patient perspective, I know from looking for mental health care, it can be incredibly difficult to be searching around, trying to find someone in your network, find someone you connect with, someone who's culturally competent, who can speak to your issues, and then, oh gosh, they're not in my network. So it's a problem on both sides, right? So one misnomer that's out there is the idea that reimbursement rates will stay the same as they are now. And that's not true. The Department of Health and Human Services will review and make sure that we set the rates at a level that doesn't cause more hospitals to struggle and close. Because what we're seeing right now is that because Medicaid, the reimbursement rates in particular are so low, a lot of hospitals that service particularly low-income people, low-income communities, are struggling a lot, and that's how you get Hahnemann Hospital bought up by these venture capitalists, right? So it is important. We understand and hear the concern. The point here is obviously not to have hospitals closing and people not being able to provide care. So it's very important, and it's built into the plan. It's part of our plan to make sure that we recalculate reimbursement rates.
So just to be clear, so the proposal that we're now talking about is to go to your question about what do we do about people not being paid enough, is to take that system that would underpay them, that would essentially bring lots of hospitals to the brink of failure as it is, and make that system a lot bigger. By the way, you're also...
No,
come on. So one thing that will happen is you have a lot of people that will either end their practice altogether because they can't make a living, because the reimbursement rates that are set by the federal government, you think it's the same in Manhattan as it should be in Oklahoma? They're going to make that, that's the absence of price control. This is economics 101. They won't know what the difference is. And by the way, you're going to be waiting a very long time as these hospitals close down for this amazing free care that you're supposed to be getting. And that's the case. That's the case in all the countries.
None of that is true.
I
don't know. You're just saying so many things that are untrue that I don't know how to come back to them. But the point of the matter is, right now hospitals are closing because people aren't going to the hospital because they don't have health insurance, right? So we're seeing rural hospital closures currently, more than we have, they're increasing at a rapid rate because people aren't actually taking their dollars to the hospital and spending them. When more people are insured, you have more money flowing to those rural hospitals. We also have a $12 billion allotment to community health centers that we've already passed, that Bernie Sanders and James Clyburn passed. And so we're supporting hospitals in that way as well. But the point of the matter is, the system becomes actually more tenable the more people are actually involved with it. And this point about wait times isn't true either. Studies have shown that when you give everybody care, it doesn't mean that everyone's sitting in the hospital every other week, every time they have a cough. Studies have just not borne that out. It's never occurred that way in any other country in the world or in any...
Speak to Canadians on the bridge and fly to Thailand for heart.
Let me jump in really quickly though. I think the only doctor on this panel, and I don't like bureaucracy, right? I don't like the red tape and things like that. Let me be very clear. Number one, the states where the hospitals are closing are the states that did not expand Medicaid, states that are going to issues like this. So the hospital closure is a result of blocking the broadest risk pool for states, and I think the data is quite strong about that.
Do hospitals take a loss on Medicaid patients?
In the system that we have now, I mean, in other words, the danger of your position is that you're standing up for a position that is failing, right, in a way. And so I think that's part of the issue. But I do also think, though, that the bureaucracy question is an important one that this program would have to address, because I do think if you go to other countries that have more universal systems, they also have less bureaucracy. So I do think, as a doctor, that this bureaucracy question is one we're going to have to address.
I think too, when we're talking about prices, we're basing it off of Medicare and Medicaid, and that's an issue because it's not a market price.
Let me get another question in.
Hi, thanks for your time. As a person whose wife works with Medicare benefits recipients daily, I'm aware that only a relatively small percentage of Medicare recipients don't pay co-pays, out-of-pocket percentages, pay for their medications, or pay monthly premiums like people on regular private insurance plans. She consistently laments having to explain to patients whether out-of-pocket costs on Medicare are constantly rising. When we talk about implementing Medicare for all, are we talking about expanding Medicare in its current state, which does include extensive out-of-pocket costs? Also, if we can't even get current Medicare to be a reasonable, clear, and fair program for the large number of people currently under it, how can we trust a position is reasonable that eliminates other options outside of a government one by abolishing private insurance?
That's a really good question, and a lot of people are asking about it. So the answer is no, it's not the same Medicare, it's better Medicare. So under Bernie Sanders' plan, there are no co-pays, no premiums, and no deductibles. There's a discrete like portion of people who have a cap. There's who would pay up to $200 a year for prescriptions, but most people wouldn't even fall in that bracket, right? In addition, we expanded to cover vision, hearing, and dental. I don't know, elderly people in your lives know that hearing aids can cost thousands of dollars, and so that's the cost. And your second part of your question was, how can you trust the government to do it in that absence?
If we haven't gotten it done right already.
Yeah, so part of the issue is that the reason we don't have a universal single-payer system isn't because it's a bad idea, but because there are a lot of lobbying interests, corporate interests, pharmaceutical interests who have been standing in the way. And we're seeing this now with people like the Partnership for Public Health, Partnership for Health, some acronym that is basically a lobbying group that is running all of those commercials during the debate saying, you're gonna get kicked off your health insurance, you're gonna have to pay so much money in taxes. That's what the problem is. So it's getting money out of politics, making sure politicians aren't hiring people who are part of this revolving door system. The ideas are good, and it takes somebody who's truly independent to implement them.
Just to give you a different perspective on this, so it really isn't Medicare for all, as I've been saying. It's something other. It's actually more than Medicare, which, by the way, is already the single biggest problem in national spending. If you believe that math matters, eventually this is going to be, I mean, this is just a fact. This is just numbers. You can argue with the math all day you want. And as to the things that it will cover, not even Canada has the breadth of benefits that are being discussed here. Canada, you have to buy your own vision plan, your own dental plan, and by the way, private insurance in Canada has been growing and growing. Oh, and a lot of Canadians cross the border here when they're like, I don't want to die, I want a good heart surgeon, and I don't want to wait a year. That's what ends up happening.
It does seem, though, a fair point, though. I mean, my first book was about the pharmaceutical industry, and it's easy to attack government for waste, but in the book that I wrote about the pharmaceutical industry, I mean, if you just want to see how much of our, I mean, pharmaceutical industry is
You are 100% right if you're telling me farmers gouging people.
it's
You have no argument.
It's freaking ridiculous. I mean, you know, they're saying that it's for R&D. It's not. It's for marketing. It's like
Correct.
So,
It's a heavily regulated industry.
Yes.
The government has a lot to
so
do
if we
with
just
it.
open up pharmaceutical, they're gonna.
If we allow more competition, yes, it would drive the price down and transparency up, actually. And as for your point, I think the actual answer is trust us, we're going to make it better.
All right, let's get another question. Running out of time.
Slightly different take. I'd like to address, as a small business owner in California, in California, I would like access to a wider, healthier working population that is also across geographic bounds. Our business is across the country, and I would like to see some uncoupling between the business side and this health and insurance side. And I don't really understand why in this argument we aren't taking the business interest like myself, where we pay $360,000 for healthcare for 25 employees, and they have out-of-pocket costs. And we do try to provide the best, but I would like to, even spending that much money, if I spent the same amount of money either in taxation or some other structure, I would like to see that we have a bigger working pool with less health insecurity. And I'd like to understand why that's not a bigger part of our structural change comment. And one last thing, I think it's a really interesting view of humanity to think that with unlimited resources, meaning you don't associate your healthcare costs with your health or what you're doing, that you would be unhealthy. Because it seems like people like myself who are fortunate to have a lot of resources now, we're just a lot healthier. So like that argument that like if we give everybody health care, like everyone's just gonna sit around and just be like eaters of like health care because it's just like what I can do because I don't have to pay for it. It's kind of weird. So
Amen, sister.
Small businesses, I'm sorry, but small businesses and mid-sized businesses, like I just would love for us to get an even playing field with the large businesses. So,
you know, studies.
Let's be clear. Sorry, go ahead.
No, I'll go after you.
Well, I just quickly, as a long line. Let's be clear. Part of what's happening now, right? And listen, if you think the system works just great right now, then you are free to not engage in this conversation at all. I think most people don't think the system we have works well right now, and part of what is fundamentally messed up is that you do have small and medium-sized businesses, right, that are, in effect, have to take on these burdens, right? I mean, the flip side, by the way, is also true, right? When you look at the fact that, like, so many working class minimum wage workers in this country qualify for food stamps because their employers aren't paying enough. So we need to have a conversation about sort of, well, what do we think belongs in not only the private sector in terms of provision, but actually, like, in terms of employer responsibility, right? So I think employers, for instance, should pay their workers enough money that they ain't poor, for starters. And I think, right? Like, just like industry entrepreneurs benefit when we have strong public education, right? Because they don't have to pay directly for the fundamental basic education of their workers. We all get to benefit, and that helps us all, and that in turn helps our tax base, and helps then future generation of schools in the same level. I personally do not think that your health and the quality of your health and the quality of care you can access should be dependent on your job, right? And so that you lose your job, you lose your health, you lose your access to health. Now, and that also then it means that small businesses and businesses in general have to work that cost in, and they have to then bear the risk. It's but have your own opinion.
Anyway, two points based on that, because I think that was a phenomenal question. First is we would do so much better as a country if we uncoupled health insurance from employment. It would solve so many other problems,
Yes.
I think. And so part of the issue is all these kind of correlate problems would be better, I think. And I think that's I think that should be the end game. I'm a psychiatrist, right? We see this in mental health also, linked to what the question was. They gave people mental health coverage, and the assumption was everybody was going to run in and get Prozac and be psychiatrists and things like that. Actually, people use the blanket of this coverage to enact more healthy behaviors. The cost actually went down. And so I think we're missing the boat here if we don't also see that giving people the security blanket of health insurance actually goes hand in hand with a bunch of other things, again, that the Affordable Care Act was trying to do, and that Medicare for All, if it does become something it should be able to do, which is not just about reimbursements, it's also about community and public health and creating better communities, healthier communities.
On that note, I apologize to the questioners, but we have run out of time, and are we ready to sing Kumbaya now? Anyway, please thank all of our panelists on this riveting discussion on healthcare.
Idealism prevails. Make the world a better place.